what happens at the Mandeville Regional Hospital, I could be blaming it on carelessness as well. Because yes, my granddad, he walked fine that day. You know, he was having a little bit of an abdominal pain. Welcome to the channel. Thank you so much for tuning in to the Think Nursing channel, where we discuss everything related to nursing, travel, and lifestyle. For those of us who are new, my name is Stacey, and I want to say a big thank you for tuning in to this channel. Tonight, I'm going to talk to you a little bit about a video I saw on the news, the death of a patient at the Mandeville Regional Hospital, and the family members weren't informed of the death, but were informed later on by the morgue. I just want to share my insight on this issue because it's just a sad situation. So my sincere condolences to the family members who are mourning the loss of a loved one who, you know, who passed under similar situation or just literally, you know, passed because of different reason. So my condolences to you, and you're in my prayers, I must say. Based on my experience, I'm gonna give you an highlight of what it looks like at the hospitals. Visitation is not around the clock, and depending on what's going on, if a patient is really sick, sometimes we go ahead and extend extra hour or two to those family members so they can spend time with them. If the patient is walkie-talkie, you know, we know the prognosis or the outcome might be positive, then we say, okay, then you just have to use the time period, because remember, as I said, there's so many things that are going on because of short staff. And if you haven't checked out my video as yet, there's a video I posted regarding some of the experiences I had back then in Jamaica, and that was only to highlight some of the things so persons can be a little bit more understandable towards, you know, the nurses. Not saying that we're trying to make excuses or anything, but some things happen, and nurses are not necessarily to be blamed, or health members are not necessarily to be blamed, but you know, it's a system problem. Once the system is fixed, then we're able to prolong life a little bit better. So the hospitals in Jamaica, majority of them are teaching hospitals. The public hospitals are definitely teaching hospitals, because we do have a lot of interns, we do have a lot of residents, senior health officer, we do have consultants, you know, and with the interns and the residents, they're always at the hospitals around the clock. So if we have a patient that is really ill and not doing so well, and we see that the patient is going downhill, I know definitely the providers will go ahead and update the family members on the status. We do grand rounds or ward rounds that will kind of help with, you know, plan of care. So we do that every Monday. The interns, as I say, they basically live at the hospital, and they will leave multiple messages on patients' relative contact or their next of kin regarding a call back, or, you know, the urgent need to come back to the hospital. But we're not going to leave a message to say that a relative had died, which, you know, definitely is not appropriate. But we will definitely leave messages to say, you know, contact the hospital regarding an urgent situation. Depending on the time of day, I'm going to give you what happens during the day shift and what happens on the night shift. And as I say, I used to work at the Mandeville Regional Hospital. I used to work on the female medical floor. So I'm giving you from my experience what we normally do. Remember, the hospital is already overcrowded. So when a patient dies on the day shift, this is what we normally do. We contact the relatives. If there's no contact for the relative, we normally wait. If it's a case where the patient died early in the morning, there's no way for us to actually keep the body for, you know, midday, 1 o'clock, when visitation is open for somebody to show up, if it's a case where we haven't gotten a chance to update that relative. So we will go ahead and prepare the body. When we prepare the body, we clean down the body, you know, and make the body look appropriate for viewing. So whenever the relatives do show up, so if it's a case where we know that the patient died at 11 o'clock and we know that 12 o'clock is visitation, we go ahead and prepare the body, close the curtains, so that way, in anticipation of visitation at 12 o'clock, somebody do show up, that person can come and view their relative. We will update them, or the doctors will update them. Then we will allow them to go around. A lot of times when they show up, if they see the curtains drawn and it's visiting hours, they know definitely that something happened. But during that time, we will leave that window open where they can come in during visitation and view the body. If the person dies at 7 o'clock and we haven't gotten 7 o'clock in the morning and we haven't gotten a relative updated on that information, We will try to keep the body probably like say 1 hour, 2 hour, depending on what's going on, you know, because as I say, a lot of times the floors are crowded. A lot of times the emergency room is so busy, we have no place to put a patient. And so if the patient dies early in the morning, 8 o'clock, 9 o'clock, and nobody shows up for visitation, and if we already know the trend, you know, you're working with these patients for days, and we know that at 12 o'clock, we definitely have somebody visiting. If somebody dies at 7 o'clock, it's unfair for us to actually keep that body on the floor for the next 5 hours. And just like in the US here and at any other hospital, we will go ahead and prepare the body and put the body in a cooler. And then from there, you know, the patient will be updated by the providers when they do show up, if it's a case where we're not able to update them and allow them to come in for viewing of that body. If they die at the time when, you know, visiting hours ends at, say, for example, 8 or 9 o'clock, and they die at 10, 11, and we haven't gotten a chance to update a family member regarding the death of that person, then we are still going to go ahead and prepare the body. We will try to still go ahead and call, leave messages and contact information regarding the death of that person. And it's the same thing. If they do not show up to view the body, then we will go ahead and prepare that body and transport the patient to the morgue. It's unfair to hold the body on a floor where it's already short of beds, and we are not able to get through to family members regarding an update on whether or not they're going to be coming back to the hospital to view the patient that had passed. So we go ahead, prepare the body, and transport the body over to the morgue. If the family members haven't been updated on the status of the death of their family member on the morning shift or the evening shift, the doctors will normally go ahead and still contact the relative or try to contact the relative, you know, regarding that update. Remember, our system is not a computer system where we can see that, you know, the body is in the morgue, or we can see that the relatives haven't been contacted as yet. After 3 to 5 days, you know, then there is a daily fee that is attached to, you know, the morgue, the service there for holding the body. So if family members haven't come and pick up the body from the morgue during that time period, or arrange for, you know, your personal morgue, there is a fee there per day. And so the morgue will probably reach out to you to ask you, you know, what is the next step. And so I think that was the problem in terms of how that information was relayed to the family member. They probably never visited at the time. I don't know what the situation is, but they weren't updated by the hospital regarding the death of the family member. The morgue wouldn't have known that, you know, the patient's relative hasn't been updated as yet, because there is nothing to track to say that this needs to be done or this is still pending, you know. So the morgue has probably reached out because of, you know, it's time now to reach out to the family members to find out what are their arrangements. And the hospital had already tried reaching out, but probably haven't gotten an update from any relative to give them that news that their relative had passed. And so the situation can be either way. The morgue reached out first, and the hospital is still waiting on somebody to call back or visit the patient to let them know that that patient that they left at whatever time had passed on this day, to give them that news. So that information hasn't been given to the family members by the medical team because nobody had called back or visited the patient during visiting hours for us to actually give them an update on the status of a relative. The other thing is that we rely heavily on visitation sometimes, because as I say, if family members are at the hospital visiting, then they will be aware of what's going on. You know, they will be updated if we're not able to get them on the phone. They will definitely show up the next day, especially when they're really sick. They will definitely show up the next day, and usually they will be informed of the passing of a loved one or a patient at the time. If they are not visiting or consistently being visited, there's no way for us to actually reach out. I know at one point, you know, you can actually try to contact the police department to try and see if they can help, but we don't have any resource like that in Jamaica to have police department try to go to this address to get that. So we rely heavily on, you know, visitation to help with relaying some of these information for the patients. I had an experience with something similar to this, and if I wasn't in the health field and if I never know exactly, you know, what happens on a daily basis, or what happens as a nurse working on the medical floor, or what happens at the Mandeville Regional Hospital, I could be blaming it on carelessness as well. Because yes, my granddad, he walked fine that day. You know, he was having a little bit of an abdominal pain. He wasn't really, you know, doing so well, but things were going on that, you know, could have caused him to pass. But to the naked eye or to the layman, they would say, you look good. Him go down there and him look good. And that was the situation. You understand? Him go down there and him looked good. The night when he passed, he went in after 7 thereabout. The visitation had ended. And by after 9 o'clock, he passed. At that time, I wasn't working at the hospital. I wasn't in Jamaica. I never really knew anybody working at the hospital as a nurse. So there wasn't any quote-unquote special treatment because I used to work there. When he passed, I didn't even know that he had died or he was in the hospital at that time. All right. So when he was there, because at the time when he visited for one thing and they ended up admitting him. So when he passed, I was told by my relatives that he passed around after 9 thereabout, probably like say 3 hours after they had left, he passed. My grandma's number was the next of kin on file, and they called multiple times and they left messages, but you know, depending on the age of the person and their familiarity with the phone and there are so many things, you know, then the information that was left on the phone might not be heard in a timely manner. And that was it for her. She had her phone, but persons were calling. She never answered the phone. Missed calls were there. Messages were there. She never really listened to the messages. And so when it was time now to do visiting hours the next day, you know, early in the morning, around probably like 8 o'clock or so, that was the time she realized that her husband had died from the night before and was at the morgue. Because as I say, if the patient dies at 9 o'clock, they cannot keep the body at the hospital from 9 o'clock until whenever she shows up for visitation the next day. It has to be a case where there's going to be a cutoff time period for them to transfer that body to the hospital morgue, which they did. If she had never visited that morning, there's no way for anybody else to know that her husband had passed. Each department is doing their own thing. The morgue gets the body because the body is prepared and, you know, is there now. They're going to contact patient's relative regarding arrangements for, you know, a personal morgue or the morgue of their choice. And they're not thinking that, you know, the family members were not updated. The emergency room, the medical floor, the doctors, they're there waiting for a call back from relatives to give an update on the matter, because during the time when they were contacting, they never get a chance to speak with anyone because the phone went to voicemail, the phone didn't ring, or the number that they have on file is incorrect. So we're waiting for them to come back to the hospital. We're waiting for them to call back regarding the messages that they've received. You understand? So there are so many things at play here. The morgues are not that big. The morgue probably can keep how many patients? I'm not so sure, but it's not a very, very large morgue. So once the patient goes over there, then they're going to try to reach out in a timely manner to, you know, get that body being moved to another, just in the event that, you know, somebody else needs to be transported over there because of an unfortunate situation. So the only thing I can say is that, you know, when it comes on to that part, we probably need to have the morgues reach out to the medical team first to see if relatives have been updated on the status of their loved one before we contact them. So send a note or something attached to the body to say, as of this date, relative hasn't been contacted. So the name tag that we send over, we probably need to put a little note to say relative hasn't been contacted or relative has been contacted. So that way, you know, the morgue can get the go ahead to update the family members on the status of, you know, the fees and everything, as well as to find out what arrangements they have in place. Because that's the only way we're going to be able to prevent the morgue from giving that information to family members. And the other thing we need to do is we need to have more than one next of kin. So in the event that we try calling this one, we ensure that we try to reach out to the other. And the only thing we can also encourage is frequent visitation, because whatever the situation is with that patient at the time, you know, I'm sure that if, I'm not saying that they weren't visited frequently, but if the patient died in the morning, there is an open window for the visitation at in the afternoon, and you also have visitation in the evening. So for the morgue to contact you regarding this situation, then that is just concerning. I'm wondering, did the morgue contact the relatives immediately, or did they contact the relatives a few days later or a day later? We need to encourage our family members to visit frequently, so that way we don't miss out on important things that are happening, you know, with the status of our patients that are in the public system, because we don't want it to be said that they're being mistreated, neglected, and being left alone, and then we are in more pain when things do transpire and we don't get a chance to say our goodbyes. So that's all I can say on the matter. As I say, it's a situation that needs to be addressed. The government, they need to work on the health system. They need to work on some electronic records. I know it's going to be a tough situation, but we need to find ways and means of improving the health sector. And you know, when it comes on to the patients especially, we need to find ways and means of doing that as much as we possibly can, in terms of, you know, ensuring that we prevent death. Whatever the situation was with the care, I cannot talk on that matter. But as I say, you know, depending on the prognosis of the patient, what is going on, death happens at any time. Because as I said, in my situation, from anybody else's point of view looking on, they will say he look good, him going there looking good, him walk strong. And knowing my granddad, he was a very strong person. So persons looking on would say that's the situation. But when I look at his lab works were saying totally opposite of what he was looking like. So I know definitely he wouldn't have survived based off his lab work that day, what had happened. And this is a lab work based on the referral he got from a private doctor, the test he had gotten done. I'm using that to say, yes, this could have happened to him because of the lab work. Based on my experience as a nurse, I can look at it and see comfortably that, you know, it could have happened at any time. So I just want to say, as I say, my condolences to the family, and for persons who are watching, you know, my condolences. I've read and I've seen a lot of persons who have said that they've had similar situations and everything. Without improvement in the health sector, the situation is just going to get worse. So I just don't know what to say on the matter, except that I was able to share my little side of what I think transpired, and my condolences to the family, and hope that we are able to fix this problem in a very timely manner. Until then, thank you so much for tuning in, and I do hope that you will have a wonderful evening. Bye.